And I suggest that we now turn to items 13, 14, 15 and 16 together. These are budget matters, progress reports, matters arising from resolutions and decisions of the World Health Assembly and the Executive Board, and engagement with non-state actors. We will address these together in order to allow us to move forward. So at this point, I will give the floor to the Executive Director, Mr. Rob Butler, to guide us through this subject matter. And also welcome Mr. Imre Hollow, the Director of Coordination and Resource Planning of WHO headquarters. I'm looking towards Rob now to see whether he is ready to take the floor.
Je peux meubler encore un peu si...
I can just keep speaking a bit longer if not. Rob, you have the floor.
Thank you, Madam Chair. So in the sake of time, I appreciate you calling us to hurry this through, in the sense that we won't be delivering a presentation, neither myself or Imre Hollow, sat here to my left, the Director for Planning, Resource Coordination, Performance Monitoring from headquarters. And thank you very much, Imre, for joining us today and for supporting us at the regional office and with this session. We will be very brief, just 2-3 minutes each. For the sake of time, the 2020-2021 information doc that you've received on PB, on the program budget 2020-2021, of course, complements the RD reports from the last 2 years. We won't be unpacking it in this session, and we won't be delivering a presentation, although we are going to share the full deck with you of slides that we were planning to present had we had time. Suffice to say that 277 million US budget was 94% financed, 86% implemented, and the details of that implementation are provided in the information document. And I'm wondering if we can put the documents to which I'm referring on the screen, please, because there are 4 documents related to this agenda item. The second point that we were going to raise, an agenda item for this session, was the increase, the PB increase to the base segment. Organization-wide, of course, you're aware that this, we saw a 600 million increase to the base segment approved, 604 million approved at the World Health Assembly. In the regional office, or at the regional level, we saw a 40 million increase to the program budget 22-23. You have received also as an information document details of how that budget space will be implemented or utilized. We said last year that we would provide you with an addendum to our regional plan for implementation. That is our plan that unpacks the delivery against the European Programme of Work. In that addendum, what we have done is outlined what we will be, how we will be using that additional budget space. But roughly, we've split that 40 million is assigned to 23 of it. 23 million is assigned to strategic priority 2, 9 million to strategic priority 1, 4 to strategic priority 3, and 3.5 to strategic priority 4. Again, I'm not going to unpack the details of that. You have that information document. It is listed on the screen here, and if you scan the QR code, you can also have the links to these documents. And then, importantly, our third agenda item for this session, which is severely abbreviated, was the program budget 24-25. And on that note, I'll hand over to you, Imre. Thank you.
Thank you very much, Rob, and I will try to be as brief as you were. So first of all, I would like to start thanking the member states of the European region for their incredible support in the past couple of years during the discussions on sustainable financing and for making that happen. And of course, I'm saying that in every region, and all the member states have done their share in this process. But this has started in the European region, and it was really championed by you, and your without your support, this couldn't have happened. Having said that, this is not over yet. This is not a done deal, and it's important to remember that the first real test will be the adoption of the program budget appropriation resolution next May in 2023 at the World Health Assembly, which will contain the 20% first step increase of the SS contribution. So until that's done, this is all a nice collection of desires and guidelines, but nothing concrete. So I just would like to remind all of us that the momentum needs to be maintained. Regarding program budget 24-25, and very much in connection with the sustainable financing discussion, during the discussions, there's been requests by member states to improve the budgeting process and the program budget. And there, I collected 6 asks which have emerged, which we are trying to address in this program budget and with this program budget process. The first one was a clear request to improve the prioritization process. And as you see in the documents, we have a much more data-driven prioritization as a starting point, which is going to be, of course, complemented with the bottom-up planning process as usual, and we hope that this is going to bring a much more rigorous process, prioritization process for the program budget. The second ask was an increased involvement of member states in the development of the program budget. And as you will see in the document, we're planning to have in every regional committee a meeting after the regional committees once the country prioritizations have concluded, dedicated to the program budget development. And then there's going to be increased consultations also at the global level in Geneva. And it seems that there's going to, the chair of the PBAC has asked the Secretariat to help organize an informal session of the PBAC towards the end of November, dedicated again to the program budget development process. So there's much more opportunities for member states to be involved. You also asked to have a better format for the program budget. One of the asks was that it's too long, it's too difficult to read, it's too complicated, and the other ask was that we need more details and would like to have a much more granularity. We tried to do both at the same time, and we will have hopefully later an opportunity to present it to you. You also asked for efficiencies, and one of the efficiency that we are proposing is that we're not asking for a program budget increase for 24-25. So that's the first element, and we will try to make do with whatever is available in terms of budget in the next biennium. And lastly, there were clear requests to understand better how the SS contribution is going to be distributed, and especially how the the increased SS contribution, the additional $200 million, will be used. And we will deal with that in the program budget document specifically. Thank you very much.
Merci beaucoup, Rob. Merci
Thank you
beaucoup,
very much, Rob
Imre.
and
Je me
Imre.
tourne vers les États
I now
membres.
turn to the member states and I'll open the debate. I will start by giving the floor to Czechia.
Honorable Chair, distinguished Regional Director, Excellencies, colleagues, I have the honor of speaking on behalf of the European Union and its member states. The EU and its member states welcome the first draft budget that includes the first increase of the assessed contributions in 2024, in line with the forward-looking decision taken at the 75th World Health Assembly in May 2022. It is of utmost importance that we aspire to implement this decision and continue to contribute to a more predictable and sustainable financing of the WHO and its work. In this regard, we take note of and want to highlight the recently published investment case for the WHO as a whole. It estimates that for every $1 invested in WHO, there are $35 of returns. It's evident and undisputed that the resources we invest in WHO pay off in terms of health outcomes many times over. We welcome that the draft proposed program budget 2024 to 2025 refocuses attention on health, achieving universal health coverage and meeting the triple billion targets. This was also made clear in the Director General's report on the extending the 13th General Program of Work 2019 to 2023 to 2025. The EU and its member states welcomed the draft proposed program budget 2024 to 2025 is fully aligned with the directions proposed in the GPW 13 extension. The country cooperation strategy plays an important role in achieving our common goals. It can contribute to harmonizing the cooperation between the WHO European region and the member states, enabling a more effective financial support for strategic actions and measuring its impact and progress in countries. We welcome the Secretariat's efforts to respond to member states' requests for greater transparency, a more participatory approach, and better prioritization in the development of the draft program budget. Key to the development of the draft proposed program budget 2024 to 2025 must be the goal of ensuring the greatest possible alignment with country situations and priorities. We commend the Secretariat for updating the results report. The report is a powerful tool and shows, among other things, strengths and weaknesses, achievements and challenges of the organization. From our perspective, however, it is a concern that only one of the 4 strategic priorities is fully funded. We note the addendum to Regional Plan for Implementation, which is built on the Regional Plan for Implementation of Program Budget 2022 to 2023 in the WHO European region, adopted at the 71st session of the WHO Regional Committee for Europe. The document shows, inter alia, the prioritization in the additional budgetary resources, which is still marked by the pandemic. We welcome the fact that there is now a clear focus on the achievement of objectives. We welcome that for every individual heading, the questions, what will success look like and how will this be achieved, are addressed. We look forward to the revised draft of the program budget with the implementation of the comments of the various regional committees through the PBAC at the Executive Board in January 2023. Thank you.
Merci la Tchéquie.
Thank you, Czechia. I now give the floor to Slovenia, to be followed by Hungary and then the UK. Slovenia, you have the floor.
Je vois que ma liste.
I see that my list is not quite up to date. I will give the floor to Hungary. Would Hungary like to take the floor? It seems not to be the case. Would the UK like to take the floor?
Thanks, Nora. Look, I won't say very much now because it's late. Just to say that I really welcome the direction of travel here in terms of greater prioritization and greater engagement with member states on how we do that. It's unfortunate that that we don't have the time for a more detailed discussion on these issues, given the way the agenda's worked out. In some ways, it's one of the most important functions of this day of the committee or the committee as a whole, and it's slightly frustrating to be unable to engage on it fully, but it would be really good to see the slides that you mentioned, Rob, and Imro, any further update on the central process. And I really would like to be able to come back to this, perhaps in the SCRC, as soon as we can. Thank you.
Merci.
Thank you, UK. On my list, I have Finland. Would Finland like to take the floor?
Ma liste définitivement pas à jour.
my list is clearly not up to date. So Norway, if I have correct information, Norway is going to be speaking on behalf of the Nordic and Baltic states. Norway, you have the floor.
Thank you, Regional Director, colleagues. I make this statement on behalf of Denmark, Estonia, Finland, Iceland, Latvia, Lithuania, and Norway. We welcome the strengthening of accountability, compliance, and risk management functions of the Euro region. With the increasing risk of misconduct in emergency context, we underline the need for strong focus on prevention and responding to activities towards sexual exploitation, abuse, and harassment, as well as on risk related to fraud and corruption. Ensuring a safe working environment and optimal use of funding and resources is important. We acknowledge the funding situation of the Euro and the rest of the organization. Although present circumstances are exceptional, the situation of the NCD-GGO serves as an example of the inherent vulnerability of this organization due to the dependency on earmarked contributions. Key agenda like NCD are at risk. We must therefore ensure we follow up and implement the conclusions from the working group on sustainable financing of the WHO. Further, we would like to understand better how you plan funding for your programs in line with the strategic priorities. In that regard, we welcome the new strengthened approach to priority setting as an integral part of the development of the draft proposed program budget 2024 to 2025. We need more time to assess and consider the substance of the approach, as the documents were made available only days before our meeting. We ask therefore also for the possibility to come back to you with further questions as necessary. However, we support the overall approach of ensuring that the draft budget will be a better management tool and improving the allocation of funding according to priority and need. We would still welcome more information about the risk and challenges involved and how we are addressing these challenges, including how the increased resources needed for the regional and knowledge hubs will be provided. Thank you.
Merci la Norvège.
Thank you, Norway. I am now looking at Georgia. Would Georgia like to take the floor? No. So I now turn to Germany.
Thank you very much, Chair. So I'm going to hold this statement in English in order to be better able to respond to what the Secretariat has just said. So first of all, I'd like to align myself with the EU statement delivered by the Czech Republic. For us, this is a decisive agenda item, and it's certainly, I echo what the UK has just said. It's a little bit troublesome that we are just coming at this stage to this agenda item, because in the end, what we have all approved will depend on whether we are able to finance it. And it's not perfect that too many delegations, well, are not here anymore because we were running too late. So we would appreciate if next time, in next RC, we would try to put this earlier. And I will come back to the challenges that we need to address in the future, because there are some, especially also for Euro. So we are very grateful to be able to discuss this. We are grateful for all the documents that we received. We are glad to see a new focus, or the focus being shifted again to the achievement of the triple billion goals, which we certainly fully support. We strongly support and welcome that the Secretariat is responding to the 6 R's of us member states. And Imre has laid them out. So transparency, participation of member states in, creating a more transparent program budget, efficiency gains, priority setting, accountability. I think I missed one, but Imre has laid them out perfectly clear. And I think, Imre, you've said, or the Secretariat has said, is this a done deal with more or less the increase of the assessed contributions, the 20% now and potentially later the 50%. And you're right, it's not a done deal yet. But what it becomes clear is that the Secretariat does everything so it becomes a done deal. So you're walking the talk, you're doing exactly what member states have asked you to do. to me, it's the recommendations and the agreement of the Assembly is kind of a contract in between member states and the Secretariat, and you're doing what you are asked to. So we hope and we expect member states to play their parts in the end and to be able really to obviously increase the SS contributions later on. We believe this was certainly a historic decision, and we obviously need to increase and keep up the momentum. It's essential that the SS contributions go up. Why? Because there's a heavy dependency of WHO overall on voluntary funding and a very limited number of key donors. And that is the challenge that I also see for this region. There obviously, Germany is the top donor when it comes to the base segment. There are obviously also other donors, but we need to diversify the donorship, and the easiest way and the best way of doing that is the SS contributions. It's quite clear that we will face severe challenges in the upcoming near future, WHO overall, also other international organizations, but also WHO Euro. Why? Because member states will need to limit their resources to international organizations because of the energy crisis, because of the war, etc. And that will come most likely in a year's time or 2 years' time, and we need to be prepared for that. And the best way of doing that is diversifying and obviously increasing the SS contributions. The other way is providing voluntary contributions on a non-predictable, in a predictable manner, unspecified resources, which we're doing. And I'm coming to an end. Thank you very much.
Merci.
Thank you very much, Germany. I don't have any other member states requesting to take the floor. So is there anyone who would like to still speak, or? That doesn't seem to be the case, so allow me to turn to the Secretariat for any reactions there might be.
Okay, I'll give it a rapid run through and then hand the floor to Imre. So Czechia, on behalf of the EU, thank you for noting, recognizing the investment case. Imre may wish to say a few words about that. An alignment of PB 2425, of course, with the GPW extension. Also for appreciating the steps and efforts to improve accountability, transparency, through, amongst other tools, the regional plan for implementation. And you also noted how indeed in that regional plan for implementation, if I'd had time, I would have liked to have expressed to you how we've adapted to the lessons learned from this pandemic in terms of how we are planning to use this 40 million in additional space. The UK, Anna, thank you very much. You welcomed greater prioritization. Of course, we will indeed share the slides. It is a shame, as Germany also said, that this comes so late in the day. We will put it earlier on the agenda next time. I appreciate both of the points from both of you. And we will have an opportunity to discuss this, both at the SCRC on the 31st of October and again on December the 1st, which is the open SCRC. So I will make sure, or we will make sure, that it sits as an agenda item and we unpack this, appreciating that we didn't have the opportunity today. I think then I hand the other points to you, if I may, for any additional. Oh, sorry, can I just, sorry, Imre. On the final point, on the diversification of donors, I mean, we struggle. I feel like I'm a broken record, and this young man was doing it for 5-7 years before I arrived. 9 years before I arrived. The diversification of the donor base, for a region that is now over 70% voluntary contribution dependent, the diversification of the donor base has and is a major priority. Bringing back in those re-emerging donors, but also emerging donors, and some of the more traditional ones, to understand that it is a huge step forward in terms of sustainable financing. It could be a game changer for us at the regional level, but still, it's just really a very small slice of the dependency that we have on voluntary contributions. And so that does bring issues in terms of predictability, as you very well explained, but also, of course, in sustainability and linear implementation across the biennium of our work. Thanks. Imre.
Thanks, Rob. I think I agree with everything that the member states said, and I think, to be honest, even if we had the full hour earlier, it would not have been sufficient to have a strategic discussions about the priorities. So I really welcome the opportunities to continue this discussion with the member states of the European region, and then also at the global level. And I think the key is that we will have to very well prepare the discussion so that we can have a truly getting strategic directions for the preparation of the global document. And really thank you again for all your support now and also before. Thank you.
Merci.
Thank you very much.
Thank you. I would like to add on the very important point, which is a priority for me. I think I told it in my annual address on Monday, on the prevention and response to sexual exploitation and abuse. I mean, my worst nightmare is that something happens like happened in DRC, which is completely unacceptable. So we have working very closely with Dr. Gaia. She's the responsible director in headquarters. She's a great mentor to me and to our people. We're doing the usual stuff, training and capacity building, but we go much further. We put, for example, specialists in Ukraine where we have major operations. I mean, where we have basically to double the staff from 150 to 300 people in very fast-track recruitments, but also in places, other ones like Gaziantep, where we're providing support to Syria, and in the neighboring countries from Ukraine as well. Ultimately, what I see is that it's about a mentality change. As I was telling Monday, there is still a lot of toxic behavior in the organization, I mean globally. And toxic behavior is also the #1 reason for burnout. So we have done I'm quite proud of this. We have a great ombudsperson, because we didn't have full time. He was recruited when I became RD, who has trained now from the 800 staff, I think 500 on psychological safe work environment. Because if you don't have a psychological safe work environment, people don't thrive. They are afraid to tell about failures. And it's trained in teams. The same for emotional intelligence. And here I want to thank my directors. I don't think I have thanked them. I have a great team of directors. Please take advantage. And I always say the #1 criterion of a completely new team was emotional intelligence. IQ, we can procure everywhere. But it's the emotional intelligence which is very important. But it's a way. At the same time, you know this because you are also transformers in your country. If you try to shake the tree, it's also very tricky because it can also boomerang. For example, I mean, the performance management system in WHO, I mean, is absolutely not optimal, to put it soft. And then you can be, as a supervisor, investigated and attacked because you tell to a person that the performance is suboptimal, which is not a harassment. So in that sense, we also have a global cadre, and we have a lot of work to do, but I want to assure you that we take this very serious. We have a lot of discussions in the executive team, 2 times a retreat every year. And again, I want to thank Gaia from headquarters. And if there's any experience in particular member states, I'm also looking to other UN agencies who have experience in a crisis situation, please approach me. Thank you.
Merci beaucoup pour ces réponses. Nous n'avons pas
have any resolutions or decisions to approve on this agenda item, but I just want to underscore the importance here of working with these budgetary issues in a more transparent and important position in future agendas, such that we address these things in a very clear way. Particularly in the report of the meeting, we can invite member states to continue to focus closely on this issue. Thank you very much. So allow me now to conclude on this agenda item. We now have 14, agenda item 14, 15, 16, 19, and 20. And what I propose is that to not let you go for 20 minutes and then just allow you to have a very quick break and have you get a sandwich if you need. So what do you prefer? Do you prefer a long break, a short break? What do you think? I think it's okay to continue, to keep going. So if you need a sandwich, just grab one, and let's continue to look at agenda item 14. 14, we have a list of documents that are going to be on the screen, and that will be the basis for our deliberations.
Attirer votre attention sur
I would like to draw your attention to the fact that the item which refers to the report of the strategy and the action plan on migrants and refugees in the region is ending that program is ending this year, but there's a high-level meeting on health that took place in March of this year in Istanbul, and so given that there's an invitation to continue, what I'd like to do is invite member states to comment on this agenda item in a written format, and thank the national coordinators and non-state actors to do so as well if they would like to add something. So can I just take it that we are going to renew the mandates in question? Are there any objections or questions about this? Are you okay with that? If there are no objections, then again, I will just assume that we're going to note it in the report and that we can conclude on agenda item 14. 14 concluded. Thank you. So now we will move to agenda item 15. 15 questions that are ensuing from the World Health Assembly and EB meetings. We have a series of documents. So I would like to mention that the Regional Committee is invited to note the budgetary implications for the Euro region of WHO, the implications of the decisions that have been adopted by 75 WHA, as well as the EB in its 151 session. So you also were invited under this agenda item to submit your written statements, again, statements in writing, so we will take into account them in the report of the discussion. I'd like just here briefly to give the floor to the chair, rather the president of the EB, Dr. Vesna Kerstin-Petric, who is going to share with us views on the link between the EB and the Standing Committee and Regional Committee. You have the floor, Madam.
Thank you very much, Chair. Not to confuse everyone, I had prepared here reflections on the World Health Assembly, but I think everybody is really seriously tired, so I would limit myself actually to what you have just proposed. So to limit my presentation now to the ways of us working together. Let me start with, of course, expressing how pleased I am to now be able to give the statement here in capacity of liaison between the Executive Board, the Regional Committee, and the Standing Committee for the WHO European region. And let me also express my sincere thanks to all my colleagues, EB members, who have entrusted me with this important role of EB chair. Maybe just go briefly or update you briefly on the outcomes of the World Health Assembly this year. and the executive board by just saying that it was important. This year was really important because we re-elected the Director General, Dr. Tedros, and we also adopted the recommendations of the Working Group on Sustainable Financing. We approved a revised program budget for this biennium and extended of the global program work until 2025. In total, we really adopted many resolutions, and this is linked to what we have just discussed, and 25 decisions. And also EB was very active, and what I think was really important was that we established the Standing Committee on Health Emergency Prevention, Preparedness and Response, and the Agile Member State Task Group on Strengthening WHO Budgetary, Programmatic and Financial Governance. You have already mentioned that we are all invited to provide comments and inputs on a number of the resolutions and decisions, so I'm not going to repeat this. And maybe I would say here that, we have actually touched upon many items that are relevant to our region. Under GPW13, for example, Pillar 1 billion more people benefiting from universal health coverage. I would like to especially mention global strategies on infection prevention and control. This was Resolution 13 of WHA. As this is also closely linked with the need to address antimicrobial resistance, I would like to welcome the plans of the regional director to develop a new regional roadmap on AMR for next year's regional committee. So here we can see, you can look at the information document of this regional committee number 5. Here we can see how our region is really responsive to what is adopted at the global level. And also the new action plan on human resources for health. This was Resolution 17. I think the launch today of the regional report, Health and Care Workforce in Europe, Time to Act, which I recommend you read, highlights the critical role of the workforce and region-wide shortages, especially among nursing professionals. And we should appreciate that now, tomorrow, I think, we will have here in Israel, chief nurses were invited by Chief Nursing Officer, Dr. Shoshi Goldberg, from the Ministry of Health of Israel to the event, which will be convened tomorrow following the regional committee. This is also important. And then regional committee agenda and discussions of the last few days also demonstrate the close alignment with other critical topics that were discussed in May. For example, the global health sector strategies on respectively HIV, viral hepatitis, and sexually transmitted infections. We have adopted those for the region today. The European Framework for Action on Alcohol up to 2025 that was discussed and adopted today, a big success. So I think we are doing fine in the Pillar 1, but also Pillar 2, 1 billion more people better protected from health emergency. A lot of close links with the agenda of this regional committee, for example, implementation of the resolution that was adopted at the special session of the regional committee, which requested the Director General to present a report on the health emergency in Ukraine. As you know, this has been done successfully. The Global Health for Peace initiative that was discussed at lunch parallel session on Monday. I thank you, Switzerland, for having taken the lead with Oman in using health action as lever to bring communities closer together and build trust, social cohesion, and lasting peace. And also strengthening WHO preparedness for and response to health emergency. This was decision from the World Health Assembly number 1. I would like to thank all member states for their active engagement in the discussions taking place in different settings to reform the global architecture. I also call on the support call on you to support Dr. Roland Dries and his co-chair, Dr. Mazzoso, to help achieve the important mission of the INB process. Now coming to Pillar 3, 1 billion more people enjoying better health and well-being. Let me here mention the WHO Global Strategy for Food Safety. This was decision 22. Which calls on member states to develop national implementation roadmaps or reflect actions to implement it within existing food safety policies and programs with the imminent risk of a global food crisis. I believe that food safety needs to be high on our health agenda. Finally, on Pillar 4, more effective and efficient WHO providing better support to countries. Let me here refer to the global strategy and plan of action on public health, innovation and intellectual property, resolution of the World Health Assembly number 14, directly links with the Oslo Medicines Initiative for access to effective, novel, high-cost medicines that was discussed during ministerial lunch on Monday. Now, success of our region depends a lot on our RD and all his staff working at the regional office, but it also depends on us, European member states, working together, supporting each other and our office in improving health and well-being of all our people. This, of course, will not be easy if we will not aim to contribute also to global health, as well as well to the ways of working at the global level. And here I would like to share with you that I'm open to all suggestions how we could do this best. So, linking global level with our regional level. Let me end with a special word of thanks to Dr. Clemens Sauer from Austria, who preceded me in this role of EB, Standing Committee of the Regional Committee Link, and as Bureau member of the Executive Board. He has contributed significantly in strengthening our ways of working at the global level and inspired many of us. I hope I will live up to this example. Thank you for your attention. I hope I was as brief as possible. From 5 pages, I managed to put it on 3 pages, but I also hope that you got all the information needed. Otherwise, a longer version will be, of course, available for you. Thank you.
Merci beaucoup, Vesna.
Thank you very much, Vesna. Thank you for your commitment and for your entire work that you've done. You've just said that, of course, committing to work together and to work towards health. So thank you very much for that, those efforts and the links that you're making between the global and the regional levels. And I would just like to wish you full success in your continuing presidency of the EB. We don't have a document to adopt under this agenda item, therefore, I would just like to close this agenda item and move to the next agenda item, which would be 16 of the agenda, collaboration with NSAs. We have a decision here. You can see the documents that are on the screen. The documents here are on the screen, and I would just like to clarify the different elements on which we are to make a decision. So the regional committee needs to take into account the requests of 4 new non-state actors, to establish relations with them, or with the WHO rather. These non-state actors meet the necessary requirements, and thus therefore the SCRC recommends their accreditation to attend meetings of the regional committee. These are the European Society for Clinical Nutrition and Metabolism, the European Diabetes Forum, the Association of Schools of Public Health in the European region, and the Long COVID Europe. In addition, there is to be a review of the status of 6 NSAs that were credited at RC69. The Regional Committee is therefore invited to adopt a relative draft decision. And so I would now invite you to share your views. However, I would like that to be done in writing, written statements only. Thank you. Now let us move on to the end of this. If there's just anyone who would like to make a statement on this, Secretary, please.
Take the opportunity and really appreciate the very strong engagement of non-state actors in this regional committee. And our regional director talked at the beginning about the new normal, and for us the new normal certainly is and has been over the last years that we've got much stronger engagement with non-state actors across our work, and we've got multiple examples for this, including the Mental Health Coalition, the Oslo Medicines Initiative, but also new partnerships in the other areas of our flagship, such as digital health, behavioral insights, and also youth engagement. So maybe just a few numbers, because we have really seen an unprecedented engagement here. 120 non-state actor delegates from 50 organizations have participated in this regional committee meeting, with 60 delegates who actually came here in person, and we really want to appreciate that a lot. We've received more than 31 oral, written, and video statements, and I really want to thank the non-state actors for their work, and I would encourage all delegates also to read and watch the statements that were put on the website, because a lot of passion and hard work has gone into those. Now, just I think you made the main points already around the accreditation process itself. This is a process that is for non-state actors who are not in official relations with WHO and who are then participating here in the regional committee without a right to vote, but with the possibility to make statements. And this has been well described, the process, in the previous resolution that was adopted in 2017. So today we are looking at the accreditation of new non-state actors, and the President has already read out the name of the 4 institutions. A review was undertaken to see that also the collaboration and the participation complies with all the criteria, including, of course, with the criteria set out in the WHO framework of engagement with non-state actors, the FENSA. So this review was undertaken and submitted to the SCRC in time, and the SCRC is now making this recommendation for the accreditation of these 4 institutions, and I won't repeat the names here. Maybe just also to add that we also have the process of the triennial review. So we underwent, and the SCRC reviewed the accreditation status of 6 organizations that were accredited 3 years ago, which means in 2019, and I will just mention those also for everybody. This is the AIDS Foundation East-West International, the AIDS Platform Europe, AIDS Healthcare Foundation Europe, the European Federation of Nurses Associations, the European Patients Forum, and the European Respiratory Society. And for all of those, it is recommended to extend the accreditation upon its own request. There was one organization that requested discontinuation, and this is the Norwegian Cancer Society. So with this, thank you very much, and back over to you.
Merci Gundo. Je vous invite donc à procéder à l'adoption de la résolution proposée, dont vous voyez la référence à l'écran. Est-ce que le comité régional est disposé à adopter cette résolution? Est-ce qu'il y a des objections? Excusez-moi, est-ce que la Serbie souhaite prendre la parole?
Serbia?
Non.
No? No, okay.
Je ne vois donc pas d'objection.
So, no objections?
Je déclare
That means that this resolution is adopted by consensus.
Merci infiniment.
Thank you very much. So we can conclude on agenda item 16.